what kind of age groups are we talking about here? Like, when would you cut off play therapy with a young person?
So I think it depends more on developmental age than chronological age.
Okay.
And generally, I would say 2 to 3 can be a good age to start some forms of play therapy, particularly CCPT, child-centered play therapy. But I think it depends more on their developmental capacity. So in order for play therapy to be effective, we need to be able to use or have children use toys in a way that's representational. That this isn't just maybe a nurse, this could be me, or this could be my mummy or my nan or my carer or anybody. And until children can think representationally, they're not going to be able to use play in a therapeutic way. They can still play and it can be helpful and fun and educative, but it's not necessarily going to be therapeutic. And normally the acquisition of language is a marker that children can start to think representationally, because this is Teddy, but Teddy is just a word, a representation of this. So I think language acquisition or other indications that children have the cognitive capacity to start to think representationally. And for some children who've experienced trauma or have other developmental delays for whatever reason, that age of onset of appropriateness of play therapy might be a bit later for some children. And the upper limit generally is around 10 to 12, but again, it can be less or older than that. So when children start to think in more abstract ways, sometimes that I think that Piagetian really window is ideal of the pre-operational play, where children can really take delight in play acting and playing things out. So they enjoy the process of therapy, but they can use it therapeutically as well. So I think the upper limit to that generally is when children are starting to move out of that phase. So for some, more developmentally advanced children, it might be 7 or 8, but for some children it might be, I've worked with children who are 15 who love this method, but they've had significant challenges in their life and they've really missed some critical milestones because of trauma experiences.
Yeah, okay.